Hi everyone, and welcome to Macquarie's Postgraduate Careers in Focus. My name is Alex, and I'm a current student at Macquarie University, and today we're going to focus on the diverse range of careers in health that you can move into with a Master of Chiropractic. Before we start, I'd like to acknowledge that this webinar is taking place on the Wallumattagal land of the Darug Nation, and pay my respects to all elders past, present, and emerging, as well as extending my respects to all Aboriginal and Torres Strait Islander guests in the audience today. As we allow some time for the attendees to join us online, please note that this session is being recorded and will be shared with you after the event, and that if you have any questions throughout this session, please put them in the Q&A box. We're going to answer them live during a Q&A session later. This evening, we've got an insightful session planned for you. We're going to start off with a panel discussion exploring the careers you can undertake as a chiropractor with Dr. Hazel Jenkins, the course director of the Master of Chiropractic, and Timothy Bellin, a Master of Chiropractic alumni. Joining them is Annie Young, a Master of Chiropractic alumni and academic, along with Stephen Sharp, a Master of Chiropractic alumni and a sessional academic/clinic supervisor. We're then going to look at how to apply for the Master of Chiropractic and class dates, followed by a live audience Q&A session with our panel. Ask us anything throughout this presentation by typing your questions into the Q&A box. With all that out of the way, let's get started. We're going to open up with some panel questions, and I'm going to throw it first to Hazel. Hazel, what are some of the most common career paths for the Master of Chiropractic graduates, and what are the current trends shaping the field of chiropractics?
Thank you. So the most common pathway after finishing the Master of Chiropractic is to enter private practice as a chiropractor. So that means that you'd be in a community-based practice. That could be part of a medical centre with other practitioners as well, or it can be by yourself. And you can either be a solo practitioner or you can be an employee or work with other chiropractors as well. It's becoming really common now for multidisciplinary practices to really try and address all the different issues and make sure that patients can reach all the different types of clinicians they need to see to be able to address their particular complaint. And so chiropractors form an integral part of these multidisciplinary practices, which is a great way to actually then be integrated through the healthcare system as well. We also have graduates who don't necessarily go into private clinical practice, and they can do a number of other different professions within health that still use the training that they've had in anatomy and disease diagnosis and assessment that they get through the Master of Chiropractic. And so this can be things like careers in related areas of pharmaceutical sales and devices. We have chiropractors who get involved in surgical teams and working with devices they use within surgeries, others that help with rehabilitation and disability advice. So it can be quite diverse careers that can be involved in after that degree.
Oh, that sounds fantastic. Speaking of those careers, we're now going to throw it to Timothy to get more in depth with that. Could you describe, Timothy, your career since graduating from the Master of Chiropractic program? More specifically, what kind of roles or specialities within chiropractic have you pursued?
Yes, so I graduated from the Master of Chiropractic program in 2020, and I went on to work at Evan Street Chiropractic in Wollongong, and I was there for 3.5 years, which I did enjoy. However, due to some life changes and changes in priority, I needed to make a change that was perhaps closer to home, and so I had to explore some options. During that time, as a chiropractor, I practiced in an evidence-based manner, really focused on rehab and active care strategies, apart from the excellent hands-on care that we can provide. I also had experience from a treatment provider's side in workers' compensation claims. So in order to do that, you need to do an accreditation process with CIRA, the State Insurance Regulatory Authority. It's a simple course that you can complete. And so during that time, I had developed some experiences and skills, whether it be at my time at Macquarie and with our amazing supervisors in clinic, or at my clinic previously, Evans Street Chiropractic. And so I looked at the workers' compensation line of work, and I investigated two roles. One was as a rehabilitation consultant or as a case manager. And so I eventually landed at Allianz as a case manager. So at present, I am currently doing some training and pursuing a role as a return to work specialist. At the moment, as a case manager, I oversee and coordinate a multidisciplinary approach to assisting workers returning to work and health. I investigate medical and factual evidence to assess claims, liability, and ultimately my goal is to become a return to work specialist, where I would be providing case managers with assistance and guidance on recovery timeframes and appropriate treatment. And in regard to the chiropractic program, everything that you learn from understanding anatomical structures, different nerve pathways and injuries to the nerves, looking at reporting from diagnostic imaging providers is all very relevant and is a very good framework for this line of work. And obviously, if you have an interest in supporting people and you don't mind doing investigative work, it's a career path that may be of interest, and depending on how your chiropractic journey may go.
All right. Well, let's expand a little more into, I guess, the nitty-gritty of the course then. Hazel, could you outline the key objectives of the Master of Chiropractic program and how they align with current industry standards and expectations?
Thank you. So the key objective of our program is to graduate evidence-based, safe and effective chiropractors who then have expertise in the management, particularly of musculoskeletal disorders. So they can help people who are in pain or who don't have as much of their normal function as they would like, particularly people whose activities of daily living are then being affected. And so we can help them get back to their healthy and full and active lifestyles. So that's our key aim. The program at Macquarie University is the only accredited chiropractic program within New South Wales. And our graduates are eligible, as soon as they finish graduation, to apply for registration as a chiropractor, both in Australia and also New Zealand. The program is also recognised internationally, and so you can use the graduation at Macquarie University to apply for registration as a chiropractor in other countries as well, just depending on their own requirements there. We're really well recognised within the chiropractic field, both nationally and internationally, as having graduates with excellent diagnostic and manual therapy skills. And this makes our students really highly sought after by prospective employers. And so we're very proud of the program that we have and the graduates that come from our program.
Absolutely. All right then. Well, speaking a bit more on employment after graduation then, we could ask Annie, one of the alumni, how did the program assist you in building a professional network or finding job opportunities? And did you have any, notable internships or clinical experiences that were particularly influential?
Of course, I can think of so many different opportunities to build your professional network and clinical experiences. So from a networking side of things, I think this really starts during your studies, because you get exposure to tutors who are registered chiropractors and your future colleagues. Also, during your studies, there's nights to get together with chiropractors in the profession who are either looking just to connect with future graduates or if they're looking for associates to work for them in the future as well. More specific to my journey, I guess. So I branched off and also pursued research as well as a career in academia. And during my 5th year of study, so the final year of the Masters of Chiropractic, one of my supervisors on my research project, which you get the opportunity to participate in a research project, he sort of set me up with a network to sort of branch off and then pursue further studies, where I completed my Masters of Research. And then I've subsequently springboarded on to become a PhD candidate. And this has allowed me to network within the profession as well as across professions with, say, physios and so forth at a national and also an international level. So that's an example about how the Masters of Chiropractic has helped me build my professional network. In terms of my clinical experiences, just sort of chronologically, after I graduated, the first year of my the first year out of the Masters of Chiropractic, I went on to complete my Masters of Research, as well as being involved in clinical practice. During my Masters of Research, I was situated in a biomechanics lab, and I was involved in testing a device that looked at spinal stiffness. So that's a very unique and interesting opportunity.
Yeah.
And after that, I took up a part-time role for a prosthetics company. So this is an example we were talking about before, how it equips you with a really strong knowledge in musculoskeletal anatomy that you can sort of springboard off into other careers. And so as part of this company, they did hip, knee, shoulder and finger joint replacements. So I was in the theatre with orthopedic surgeons, nurses and so forth. And it was just really nice experience because you got to see exposure to really complicated musculoskeletal conditions that might not be managed in primary care in a chiropractic office. It's sort of that later down the line, but that was a really useful experience. And then obviously now pursuing a career in academia and doing my PhD in clinical practice still.
Fantastic. It sounds like a very rewarding process you've had.
Yes.
Let's turn now to some of the more practical aspects of being a chiropractor. Stephen, could you outline us in what ways does the course prepare students for the business and management aspects of running a chiropractic practice?
Thank you, Alex, and thanks everyone for being here this afternoon. And I guess it comes in multiple ways throughout the program, and I think the main ways it comes across is through your clinical internship, which happens in the final year of the program. You're exposed to different operations of a chiropractic clinic, from both a clinician performing duties like working with patients, managing their acute and chronic health conditions, using your interpersonal skills to build rapport with patients, developing your diagnostic and prognostic skills, being able to say to someone, this is what's going on and this is how long I think it's going to take to get better. And obviously building your hands-on and your rehabilitation skills, and doing this in a format of understanding how a clinic runs on a day-to-day basis. You also get to participate as a receptionist, which I think is a bit of an undervalued skill. You get to see how a clinic runs just from an operation standpoint. So things like booking in patients, managing that patient-clinician interaction, taking payments and ensuring a timely management of the clinic. These are all important skills that you get exposed to in your clinical internship, which I think better prepares you to think about some of those challenges or those things you need to think about in terms of running a business and managing a business. You also, as Annie mentioned, you get exposed to experienced clinicians, educators and researchers on a regular basis, and they often give their practical tips on how to run a clinic and the things they find interesting, and maybe some of the challenges that they've had during that process. That's a continued exposure that you have throughout the whole program. You also have opportunities to network and observe chiropractors in the field. So, at our clinic, we have students coming down regularly and spending the day with us. And I think that's a valuable experience for the students to just get a sense of what the day-to-day kind of life is of a chiropractor out there in clinical practice. And there's also lectures. At the end of the program, there's lectures that help describe the different employment opportunities, from running your own business to working for someone as a contractor or as an associate, or an employee. And so I think you get a broad range of different experiences on how to run a business and different management strategies. Yeah,
excellent. Thanks for that. We're going to turn to Annie now. How how well did the Master of Chiropractic program prepare you for your current role, do you feel?
I think it was extremely important and prepared me extremely well for sort of springboarding into all these different careers. So I think first and foremost is the extensive knowledge that you gain about musculoskeletal disorders, the impact, assessing, diagnosing and managing. And this is achieved via extensive units in anatomy, physiology, pathology, and these sorts of things, which has allowed me to sort of go off into an education pathway, a research pathway, and then also obviously clinical practice, as well as taking those skills to a med device sort of company. Also, there's a big emphasis on evidence-based education and research in the program, and I think this sort of fostered this curiosity in me, which ultimately was quite pivotal in me pursuing further research after graduating as well. And then I guess lastly, which has already been touched on a couple of times, is that multidisciplinary aspect and really teaching those collaborative approaches to get the best outcomes for your patients.
Oh, excellent. That sounds great. Thanks. Moving forward with Stephen, could you just outline for us what are some of the support or resources that are available to students for career planning and job placement?
Yeah, thanks for that. I think there's a little bit of double up from what I've sort of said previously, but I guess one thing that the program offers is these prospective job evenings where students get to attend, chiropractors attend that are looking for potentially new graduates. And it's a really nice opportunity to network with chiropractors and be exposed to different forms of care. As a way of kind of setting yourself up for a job after you finish the Masters of Chiropractic program. So it kind of facilitates that kind of blend between, you know, being at university and then out into the real world with being in clinic. There's also Macquarie offers some general career advisory evenings to provide information around other opportunities, and we've kind of touched on a few of these things, you know, whether you're wanting to jump into an academic role or a research role or, you know, insurance or, you know, things of that nature. And then, as I said before, that I think the interaction that you get that's continual throughout the whole degree with the chiropractors, the tutors, the lecturers, your supervisors is really where you get that hands-on experience around the support for planning your career after you finish the degree.
Well, I guess to speak a bit more on career planning and networking, we'll turn to Hazel and just ask, what kinds of partnerships or affiliations does the program have with clinics and healthcare facilities?
Thank you. So the program actually runs 3 chiropractic clinics. So we have one on campus at Macquarie University. We also have clinics in Eastwood and in Summerhill. So these clinics are chiropractic clinics for the community. So public patients come to the clinics, and this is where our final year students, so the students who are just about to graduate, actually get that clinical experience that Stephen was talking about earlier. And so they treat members of the public. They're, of course, fully supervised by practicing chiropractors. And so it's a really great opportunity for them to actually integrate all of the skills that they've learned throughout the program and put them all together in a safe and supportive environment, and so they can really see and practice what they're going to be doing the following year when they graduate as a chiropractor. So that's a really great opportunity. We also have within that final year a number of different placement opportunities, and this helps to give the students access to different types of patients. And also helps to give them exposure to different sort of specialties as well. So we have placements where they can work with Indigenous people. They can work with the Bill Cruz Foundation, which particularly looks at unhoused people. We have sporting placements, so a number of different events, whether it's working with a sporting team, such as a rugby union team, for example, or going to different fieldwork events where, for instance, they go to City to surf and work with people who might have injuries along the way. And then we also have radiology placements as well. Chiropractors are taught to be able to take and interpret x-rays, and so they have radiology placements within the Macquarie University radiology clinics, where they work with a number of people coming in to get imaging done as well. So yeah, a number of different options through there.
Sounds fantastic. Well, thank you, everyone. That's been a really thorough look at all things chiropractic. We're just going to close out this portion of the presentation now by asking a question to each of you in turn. And that's just broadly, what's a piece of advice that you would give to someone considering the Master of Chiropractic program? We might start with Tim, if you don't mind.
Yeah, I do believe that if you do this program, it sets you up with a lot of skills to excel. I think that the time that I did spend at Macquarie University as a student of chiropractic equipped me with a lot of skills. I review a lot of medical information every day to guide my decision making, and if I didn't have that background that was set up for me from this degree, I don't think that I would be excelling in the way that I am at the moment. I think it's a fantastic way, whether you stay within the direct chiropractic profession or you pivot out, the skills that you do get from this degree are very useful in various ways.
Fantastic. Annie, do you have any advice?
I guess 2 takeaways is make sure that you approach your studies building your professional network. You're going to be in the classroom with your future colleagues, whether they're your fellow classmates or the tutors, and then stay curious as well and really ask the hard questions, and maybe you might pursue a career in research in the future.
Fantastic. Stephen, any advice?
I think the main thing is if you're interested in helping people, it gives you a really nice foundation to improve someone's health. You get all the different, the skills, the exposures, you get supported through that process. And it then, gives you these, curious mindset around, what can we do to better someone's health and get them on the right path to getting back to the life that they want to live. So if you're interested in helping people, I think it's a great option.
Beautiful. And to round it all out, one piece of advice from Dr. Jenkins.
To echo what everyone else has said, I think actually considering the Master of Chiropractic is a really great opportunity to build your skill set if you are in that health related field. So I'd say just jump into it. As Annie mentioned, it's a great way to build up those collaborative networks, and in particular we find that the students within the Master of Chiropractic are really close-knit groups. They have a lot of interaction with each other. They build really strong friendships throughout the program. So as well as being really positive for their careers, it's also very positive for their social networks as well. And I think it's a great way to just get started. One of the things I would say though is that it's if you're not if you haven't been exposed to chiropractic that much, another great thing to do if you're considering it as a career is to speak to chiropractors out there in the profession already. And, most chiropractors in practice are very happy to hear from prospective students and to, let students come through and just see what happens, or just give them some ideas from their own practice, etc., as to how their careers unfolded as well.
Okay, fantastic. Well, thank you all panelists. We'll hear from you more a bit later, but for now, we're just going to have a brief presentation on some more of the, a few of the aspects of the Master of Chiropractic, along with some dates that's led by Dr. Jenkins, whenever you're ready.
Okay, so in this presentation, we're just going to run through a few details about the Master of Chiropractic program here at Macquarie University and how you can apply for it. So firstly, I know we've just had a bit of a panel discussion about different career opportunities from the Master of Chiropractic, but I just wanted to quickly overview what a chiropractor actually is. So chiropractors are healthcare practitioners who assess and treat a wide range of musculoskeletal health conditions. We have a focus on spinal pain, so low back and neck pain, but we also can treat other musculoskeletal areas such as your knees, elbows, wrists, etc. To be able to assess and treat these conditions, we have a number of diagnostic tools. These include patient interviews or histories, the physical examination we perform to try and work out where the problem is and what's causing it. And we can also do diagnostic imaging as well. And chiropractors are actually taught how to take and read their own x-rays. We do the diagnosis and assessment to work out what condition the patient might have or what's going on with them. And then we can treat a wide range of these conditions using a number of different treatment options. These include education, reassurance, and self-management advice, manual therapies, which is probably what chiropractors are known best for, and that includes things like joint mobilizations, manipulation, and massage, and then exercise and rehabilitation. Importantly, though, chiropractic is not just about treating pain that people might come in with. We will also be able to treat and help people with their function and getting back into normal activities of daily life. And so this can really help people have an active and healthy lifestyle, which can be beneficial for them across many aspects of their life. We can also help with a number of different chronic diseases where we know that an active, healthy lifestyle actually helps to improve those other diseases. So things like obesity and chronic diseases such as heart disease, arthritis, etc. We won't be treating those conditions as such, but by getting people back into being able to exercise more freely and get more active, that can help in the management of those conditions. So we've been through in the panel discussion a number of different career opportunities that are available after completing the Master of Chiropractic. But just to sum up, these include clinical practice. This might be by yourself, or it can be multidisciplinary or cross-disciplinary, working with a number of different healthcare practitioners. Might want to go into more specialised areas such as sports chiropractic, for example. We might do training and injury management and also help to optimise their physical performance. And then we had a range of health consultant type positions that includes things like insurance assessors, medico-legal advisors, and rehabilitation providers. There's a wide range of different health-related careers that you can do that don't involve being in clinical practice as well. Finally, you can also follow a research pathway, and the Master of Chiropractic can lead directly into our high degree research training roles with direct entry into the second year of the Masters of Research available after the chiropractic degree program. So how do you actually become a chiropractor here at Macquarie University? So to be a registered chiropractor in Australia, you have to complete the Master of Chiropractic to be eligible to apply for registration as a chiropractor. Now, there are two ways to get into the Master of Chiropractic itself. The first pathway on the left-hand side here is if you come in through a Bachelor of Chiropractic Science, which is also held at Macquarie University. That's a 3-year full-time degree, and that includes a number of elements of chiropractic training already embedded within that degree. If you come through that pathway, you move into the Master of Chiropractic and you get straight into the second year of the Master of Chiropractic program, giving overall a 5-year program as the minimum to complete that pathway. The Bachelor of Chiropractic Science, you apply for that through ATAR, through UACS, sorry, and it generally has an ATAR of 80 as guaranteed entry. The other pathway is for people who have come in or want to come into the Master of Chiropractic after having already completed a bachelor degree in another health science discipline. And that we can get students from a number of different areas. They can do health science degrees, exercise and sports science degrees, probably two of our most common, but there are a lot of different health science degrees that can be used as entry to the program. So that will generally have been a 3-year full-time degree. And then you can apply for entry into the Master of Chiropractic. And then you'll come into the full Master of Chiropractic program, which will be 3 years full-time. Basically, the first year of that program will be covering a number of those chiropractic subjects that were also covered in the Bachelor of Chiropractic Science. The entry for this is also through UAC. The entry requirements are a weighted average mark of more than 50 from your previous studies, and you have to have done at least 1 anatomy unit and 1 physiology unit as part of your undergraduate studies. So to apply, as I mentioned, you apply through UAC. The course code is listed here, and you want to search for that and include it as one of your preferences. The application deadlines for next year are the 10th of February, with classes commencing in the 24th of February in 2025. To complete your application, you may require a number of documents, so things like proof of your Australian or New Zealand citizenship, evidence of academic qualifications. That's very important for your undergraduate degrees, and you'll need your transcripts for that as well, and evidence of English language proficiency if that's required. If you did come through the Bachelor of Chiropractic Science, though, no extra material is required because we already have the information from the bachelor's degree. So just wanted to provide a little quick summary of what you will actually learn within the Master of Chiropractic. So we cover a number of different domains. The first and probably the biggest domain is your clinical sciences. So here you'll do a range of different subjects which cover the clinical skills. You'll learn how to actually perform the treatments that you need to be able to do, how to perform the assessments that you need to be able to determine what treatment to perform. You'll learn a lot of pathology and diagnosis. So this is where you learn about all the different conditions that can present within the body and how you can diagnose those. We do some more specific types of assessment in terms of learning about the neurological system in neurology and about the musculoskeletal system in orthopedics. As I mentioned, you learn how to take and read diagnostic imaging, in particular X-rays. You do more in terms of rehabilitation and sports medicine. And we also have additional subjects such as things like nutrition and pharmacology, which while as a chiropractor, you may not always apply yourselves, you need to know about these because there are often other treatments or other things that might be helpful for your patients. We have a research stream through the program as well. We talk about how to integrate research into your clinical practice so you can be an evidence-informed practitioner and you can integrate recent findings within your practice and help inform what treatments you'll provide to the patient. You also do a major research project in your final year of the master's program. And here you can actually have the opportunity to be part of a research project and you finish up by writing a paper that will be ready for publication. And this can lead to further research opportunities as well. And finally, we have our professional practice stream. And this is where you do your actual clinical internship. So in the final year of the program, all of our students are in our clinics. These are 3 clinics that the Macquarie University runs, and here you will assess and treat patients that come from the public. You'll be fully supervised, of course, by practicing chiropractors. And so it's a really great environment to actually put all of the skills that you've learned over the previous years into practice in basically the same environment that you'll use when you go out into practice after graduation. In the professional practice units, we also cover a lot of legal and ethical requirements and also business management as well. Finally, we have a lot of opportunities for placements and events as part of those clinical units. And so this is just showing some pictures from a number of our sporting events, but we have also placements at places like the Indigenous centres to also help to give you exposure to a wider range of different people. So thank you very much. And hopefully you will be interested in applying for the Master of Chiropractic and we might see you in this degree in the future.
Thank you for that. Again, remember that this presentation will be made available at a later date to you, along with all of those dates. With that in mind, we've now got 15 more minutes and we're going to move on to some general audience Q&A questions, which I'm going to field to the panel as a whole. So we're going to open up. Anyone who feels they have an answer, just feel free to pipe up and we can have an open discussion. What is the difference between a chiro and physio? And why did you personally decide to go down the pathway of being a chiropractor as opposed to a physiotherapist? Anyone who feels they have an answer, feel free to speak up. Did any of you initially want to be physios and then later change?
I can tackle this one if you want.
Please.
Yeah, I guess so. Traditionally, I think there's perceived to be these differences, but I think as time's going on, we're probably more similar than we are different. I think some of the core tenets of chiropractic is the hands-on approach. And traditionally, we've been involved in private practice only, whereas physiotherapists have had the opportunity to be in private practice as well as the hospital-based setting and working with, complex neurological conditions and post-stroke rehabilitation. If I reflect back to my experiences prior to deciding to be a chiropractor, it was from my own experiences with injuries. And I always found that the chiropractors were really attentive and took a lot of care in trying to understand the individual that was in front of them. And I found that really beneficial as a patient. And then as a result, decided to become a chiropractor and have really enjoyed being able to have this continued learning and continued development and be able to now work with physiotherapy colleagues to, figure out which, one's not better than the other. We all work really well together, and we have our unique perspectives on looking into different health conditions. And I think as a chiropractor, it's really rewarding working with our colleagues in physiotherapy and obviously our colleagues as chiropractors. So hopefully that helps. Does anyone else have any additional things to add?
Okay. We'll move on then. Another more coursework-based question, which I might field to Annie, a recent alumni. Annie, how many days could prospective students expect to be on campus while studying this course?
So the workload, especially in the master's stream, Hazel might be better positioned to answer this question, but just from my previous experience, I was sort of on campus 4 days and then studying at home, but it is a full-time study load if you choose that mode. There is part-time options as well if you feel you're unable to commit to that, but it is equivalent to a full-time load if you choose that method.
Is there anything you'd like to add to that, Hazel?
Yeah, in terms of the actual timetable and the number of days throughout the master's program, it depends on the year that you're in, and it will usually be between 3 to 4 days that you're actually on campus for classes. I think there's one semester where there are classes on all 5 days. We have a lot of face-to-face classes, a lot more than a number of other programs, because we do have a lot of hands-on involvement. And so to learn those hands-on manual skills, we need a lot of practice time within the classes, and that has to be done face-to-face. A lot of our more theoretical options now are being delivered via online modules, so you can take those at different times and do that from home, etc. So it can help to work into your, otherwise busy lifestyles. But as Annie mentioned, it is a full-time course load, and we do have a high practical involvement.
I guess speaking more on that practical theory, if I could ask you, one of the watchers has asked, what is the balance of practical classes? What is the balance of practical classes / assessments versus theory assessments?
Mm-hmm. Yep. So for most units, so we have a split of different units. So some units are more theory focused, and in which case they'll be largely lectures. All of our units though would have some sort of tutorial, so you've got that opportunity for engagement and discussion with different tutors as well. So those ones would usually be about say 2 to 3 hours of lecture a week and 1 to 2 hours of tutorial. For our more practical classes, you're probably looking at more like about 2 hours of lecture online delivery to about 4 hours of practical classes throughout the day. Our assessments are a mix of practical assessments that are done within those practical tutorial times, and then of course your theory assessments, which tend to be held more at the end of the semester in the exam periods.
Fantastic. I might ask this to all the panel members to ask them from their personal experience. Can I work full-time while completing this course?
I'll jump in first with that one. So to actually work full-time as well as do the course, you would probably have to do the course as a part-time offering. It would be very difficult, very challenging to do both. We do know, I think everybody probably knows someone who has done it. And so it is possible, but it is very difficult for them. Something's got to give somewhere. There's only so many hours in the week. The course is designed, as university courses are designed, for a full-time load across the board at a 30 to 40 hour week, in combination of where you have to be on campus, but also your home study that has to be factored in there as well. So add a full-time job on top of that, you're rapidly running out of hours in the week. So we recommend people, if they need to maintain full-time work, that they do take a part-time offering of the course, and we can help work out the best plan for that across the years, so that they can succeed in the degree program.
Fantastic. Yeah. Another quite broad question. A watcher has asked, how has the Master of Chiropractic evolved over the years, and what can future students look forward to? If anyone has any opinions, feel free to jump in.
I mean, I can have a go.
Please.
It's constantly evolving, just like healthcare is constantly evolving. So as more evidence comes out around maybe looking at conditions in different ways, or looking at certain subgroups or different populations in different ways, the program then gets updated. So since when I did the program to where the program is now, there's been a lot of change, there's been a lot of development, and people like Hazel have been on the front foot, developing curriculum standards for particular conditions like low back pain that push the field in a really positive direction. So I think rest assured that us as academics, we're constantly trying to keep up with the latest, and as a result, that gets filtered through into our teaching. So it's something that at Macquarie we pride ourselves on, being able to stay up with those trends, so that the students are getting the best available information.
Fantastic. Yeah. We've got one more question here, probably best suited to Hazel again. Our watcher has asked, what are some key qualities that you look for in an applicant to this program?
That's a really good question. This can be very broad. One of the key qualities we want is just that engagement of, wanting to study this, wanting to help people, wanting to be within those healthcare professions where you're going to be dealing with musculoskeletal conditions, and really helping to help people get back to their normal lives. I think that enthusiasm is really one of the key factors we would look for. As Annie mentioned earlier, I'd say also curiosity. And so I don't think you can get into a health-related field without really wanting to know why the body works, and why things, why injuries happen, and how they then heal and get better, and how we can help that happen. So having that curiosity and that asking why things work a certain way, or how we might do things differently and better, I think that's a really important characteristic to have as well. And then there are other characteristics that I wouldn't say you necessarily have to show on entry to the program, but things that we'll really try and develop through the program. And a key one of those is communication skills. So really being able to communicate well with your patients, but also then other professionals, healthcare professionals, the community, etc., is one of the key attributes that we really try and develop in our students throughout the program. And so, it will depend as well where you end up going. And so we've got some students who come in because they're really interested in this field, but then decide that clinical practice isn't the way for them, because they don't necessarily want that daily communication and daily engagement with patients. But that's when they'll potentially go into other career pathways that still use that same knowledge, those skills, and they're in the same field, but it will actually play to their strengths a bit more as well.
Okay, fantastic. Thanks a lot. We've got a few minutes left, so I think I'll open up a broad question to all of the panel members. If you could just describe for us, each of you, what is the most exciting part of this degree? Something that students really have to look forward to when studying chiropractic.
I'll go first.
I think it's okay. You go.
No, you go, Steve. You're up.
Something that I've really taken from it is the friendships that you've developed. Like some of the people that I met during the program are now my best friends, and we work together and we get to catch up, pretty much every day. And I think whilst learning new skills and knowledge and all those things, becoming a clinician is obviously great. Some of those friendships, I think, are something that I really, really cherish and have been really helpful at certain times throughout my career thus far. That I can turn to those people and ask them for really honest and valuable advice. So I think part of it is you spend so much time together. It's really nice that you get these great friendships that last.
Fantastic. Did you have something you wanted to add, Annie?
Yeah, I guess my interpretation of the question was sort of during the program. I think during the program, it makes you very aware of everything that's going on around you, and it's really interesting sort of observing how people move and trying to fill in the gaps and use all your knowledge that you've learnt through anatomy and diagnosis and all these sorts of things. And people will just come up and chat with you about their particular conditions, but it's just really applicable to every sort of interaction that you have, everything that you see in the world, and these sorts of things.
Do you have an opinion on the most exciting part of the degree, Timothy?
Yes, for me, I think it was going into student clinic, actually. Seeing how you can, as Annie mentioned, putting all the things that you've learnt together and see the type of chiropractor that you're going to be, as well as the first time, I suppose, that you really can see that you're making a difference into someone's life. When you can see that they've come in with a specific condition and you're giving them advice and treatment that directly changes their condition. I think that was a really exciting point for me in my time as a chiropractor.
Absolutely, yeah, absolutely. And finally, Dr. Jenkins?
Yeah, so I might answer from the perspective of what I see in students. It's been a while since I did the program myself now. But one of the things I love the most is just seeing the students start to put everything together. And so, you're teaching them all these little building blocks of this different knowledge, this different skill, etc. And they've got to, sort of get a handle on all those things and then start to put it together so they can then take a patient case and start to understand what's happening in that person and actually how am I going to design a treatment strategy to try and help that person. And when you see them starting to put all that together and sort of see those light bulb moments, I find that's really rewarding and really engaging, and the students tell me that that's what they really enjoy about it as well.
Fantastic. All right, thanks a lot everyone for the answers to the last questions, and thank you broadly as well for answering the questions over the course of the presentation and for providing so much helpful information in regards to potential chiropractic studies. Thanks a lot. We've now come to the end of the webinar. Thank you all the viewers for joining us this evening. A gentle reminder to submit your application if you'd be like to consider it for February intake next year. We're also going to send you a recording an email of this recording in the next week or so. Ultimately, we look forward to seeing you all at Macquarie University soon. Thanks, everyone. Take care.